Hi, I'm Dr. Tyler Kowalski and I'm here with Selena, and today we're going to give you a little look in our office about kind of some of the things we do as far as chiropractic adjusting. Some offices they just kind of focus on the neck and the back, but in our office we kind of adjust all the different joints in the body if necessary. And so today we're going to be focusing on the feet. So I'm going to show you kind of what a foot adjustment looks like and some of the things we can do to help if you have foot pain and things like that. So I'm going to have Selena lay on her back and we're going to check out her feet here. So when we're talking about the foot and ankles, and I'll put this under her knees to make it a little more comfy there. So when we're talking about the foot and ankle, there's kind of 26 different bones that can get locked up and not move right. So the step one, we want all the bones and all the joints in the feet moving well. If they're not, then that's when you get things like plantar fasciitis, different foot injuries like ankle sprains and stuff like that can flare up and happen. So what we want to do is just make sure all the bones and the joints in the feet are moving well. So there's, like I said, 26 different bones that we're going to be kind of checking out here. And the other thing we want to make sure is there's no major rods or any previous injuries. So we do a good history, good exam on the patient before we adjust and just to make sure there's no contraindications to that. So what I'm feeling for is if there's any restrictions, joints that are really locked up, not moving good, that's what we're going to make sure. We want to restore that good motion and that good movement in the feet. And so there's a couple different ways that we can adjust the feet, and so I'm going to show you just a few of them here. So the first one here is just using my hands, just the manual way. One thing when we're looking at the feet, we want to make sure they have good dorsiflexion, that movement up and down. If you lose the dorsiflexion either in the big toe or in the foot, it can actually affect the knees, the hips, and actually maybe cause you to be more hamstring dominant and cause some hamstring sprain and strains too. So a lot of things to look at when we're looking at the feet. They affect a lot of things in the body. So the first thing we're going to do is do just kind of a gentle adjustment on the foot here. Just kind of go through all the range of motions and get this moving good here. Good. Check all the toes. Good. One more right here. Good. Sometimes you'll feel or hear a little pop or a crack if that joint's really locked up. Sometimes you won't. With the feet, sometimes the joints will be moving good without hearing anything. But the technique or the protocol I'm using is called the Charette Method, or protocol. If any of my chiropractic colleagues are watching, that's what I'm using here. So that's kind of just a general foot adjustment, just kind of making sure we're getting all the joints in the feet moving well. If they have a lot of pain or real sensitive in the foot there's the activator tool here we can also use to adjust the foot. It just gives a gentle little thrust and puts that good motion in the foot. So here's on this foot I'm going to use the activator to kind of get this foot moving well here. So real gentle. We can use this throughout the whole body. If some people don't like that pop or the crack, or if they have had a previous surgery or something, we want to be real specific and be real gentle around that area. We can use this activator tool to kind of get the joints moving well with this. All right. And it's as simple as that, just kind of a couple of feet adjustments, just making sure, like I said, getting all the joints moving well, especially if you have like plantar fasciitis or foot pain kind of on the bottom of the foot. Step one we want to do is make sure the joints are moving well, and that'll take the stress off the muscles and the ligaments on the bottom of the feet. In the next video, I'll kind of show you some of the other therapies and different treatments we can do to help restore kind of good strength, stability, and also maybe some other things we can do to help with foot pain. And that's